Hope Channel, changing lives.
Good evening and welcome to the consulting room. I'm Mami Fokosa. I hope you've had a very good day and you are enjoying yourselves today. Who doesn't like breast? Children love it, men love it, and women. Everybody loves breast. So I'm sure you're going to really enjoy today's show. I have here with me today doctors
Ekia Jenima Isime Mills
and
Akusia Ameli.
Okay. We are going to have a very interesting discussion on the two beautiful projections on most women's chest. So today we have a story we have an issue from one of our viewers, and she's called Madam. She's called Madam Clara. She's 55 years and she's the second of 5 daughters born to her mother. Her mother died 3 years ago from breast cancer, and she's noticed some changes in her breast, the nipple area. Despite reassurance from her doctor, she still has sleepless nights because she's so scared. She has asked her friends if they have experienced similar changes, and all they say is that it might be breast cancer. Why can't she feel the same way as her friends feel? She first had her menses when she was 13 years, and currently she's 50 years, and she's having her monthly menstrual cycle. She, at a very early age, had to start taking oral contraceptive pills because her cycle was irregular. And because of all these things that she's been experiencing, she's feeling less of a woman. So she doesn't know what to do. She wants us to help her today. So please, can you tell us what is so nice or important about the breast that it makes women feel so good or sometimes so bad about themselves?
Okay, so the breast has mainly 2 uses. It has the functional use, which is for breastfeeding, and also the sexual use, because it contains a lot of nerve endings, especially in the nipple. So the most sensitive part of the breast is the nipple. And it makes you feel more of a woman, you know, in terms of sex. And also when a woman gets pregnant, it's every woman's dream, if not for every woman, most women's dream to bear a child and then breastfeed their own baby. So it is very important as a woman to have breast, and without the breast, it makes you feel like less of a woman, and also society will judge you.
Society?
Yes.
Oh.
Because it will be very weird to see a woman without breast.
Well, talking about society judging someone, I have a friend who shared with me that he also had a colleague who broke up with his fiancée girlfriend of 3 years on the grounds that he was expecting her breast to become larger, and because she doesn't have big breast, she might not be able to feed his children well. So I think this society thing is really true.
Yes, yes. Society plays a very important role, because like I said, it's very weird to see a woman, an adult woman, with a flat chest or without breast, even though men have their own preferences. But if the chest is flat, then there's an issue.
Okay.
Yeah, so it brings some form of self-esteem. So without the breast, a woman feels less of a woman. Yeah.
Oh, okay. I'm sure this point would come up when we talk more and delve more into the issues concerning the breast.
Yes.
So now everybody thinks breast month is about breast cancer. Is breast cancer the only thing that happens when we have things, when we have issues with our breast, Dr. Akosia?
Okay, so breast cancer is not the only pertinent or interesting thing about the breast, if I should say. There are so many things that can happen to a woman's breast, and so even as we celebrate Pink October, we also have to consider these other things that could be happening to a woman's breast. For the breast, there are different diseases that can affect it. We have the things that are not malignant, like breast cancer, and then we have the malignant things like breast cancer.
Dr. Akosia, please. A lot of
malignant.
Please, what is malignant?
Okay, so when we say malignant, we are referring to, it's a term given to cancer. It means it can actually cause death. It's deadly.
Okay.
And so when we say something is malignant, it means it's deadly.
Deadly.
Yeah, I should say.
Okay. So what are some of the non-deadly or non-malignant things that happens to the breast?
Okay, so for the non-malignant things, for many women, you can have issues in terms of you feel a lump in your breast, and then you would wonder, is it breast cancer or not? Especially in young women, when they feel a lump in their breast, it's very likely to be a benign condition we call fibroadenoma. It's a lump in the breast that is usually hormone responsive, like it gets more tender, gets into your menses, it can get bigger, get into your menses, it can reduce in size, it's very mobile, it moves around nicely, it's not hard, it's just a bit firm. That's fibroadenoma. Then we have something we call mastitis. That one, it's like an infection of the breast itself. And for most women, it usually happens in women who are lactating. So that's mothers who are breastfeeding. Sometimes during breastfeeding, you know, the babies, especially the ones that have teeth, can bite, and then there'll be a crack in the nipple, and then you have a bacteria infecting your breast, and it becomes very swollen and tense. It can be reddened, painful, and we call that one mastitis. And for such cases, women can be very worried, and when you go to the hospital, you are concerned. I mean, we treat it with antibiotics, but then the concern is, should I still breastfeed? Can I still let my baby suck that breast that is infected? And the consensus is yes, you can breastfeed your baby when you have an inflammation of the breast called mastitis. And then we have other things called galactorrhea. That one's a big word.
Yes,
it's a big word, but it just has to do with discharge from the breast that is milky. So if you're a woman and you start seeing that there's some whitish discharge from your breast, it's also a condition that you have to consider. And that one usually has to do with some hormonal issues. So because of that, you are producing milk, especially if you are not pregnant or breastfeeding, you are producing milk that is not supposed to be produced at the time of your reproductive year that you are in. So in that case, you actually have to seek medical help because it can affect fertility. And then we have something we call duct ectasia. Big word, but it usually happens when there's some greenish, brownish discharge from the nipple. It's also not malignant, but it can be scary to see that kind of color coming from your breasts. So that one, you have to see the doctor. And also talking about lumps, there's something they call traumatic fat necrosis. It's a big word, but it's very simple. Sometimes you walk around and then maybe your breast went to hit something, or you had exactly, yeah. You're getting out of the church and before you knew it's ouch. Yes, and when it happens like that, sometimes the fatty tissue in the breast, it dies and then it becomes hard. So you feel a hard lump in your breast and then you become worried, hey, do I have breast cancer? Anytime you feel any lump, don't hesitate to go to the hospital so that you can at least allay your own anxieties, especially when it's benign. These are a few of the benign conditions.
Okay. So we are talking about cancer, breast cancer. What is cancer? Because we all get scared when they mention cancer. What really is cancer?
Okay, so cancer is simply the uncontrolled growth of abnormal cells in any part of the body.
Okay.
That's the simple definition for cancer. So when we talk about breast cancer, then we are talking about uncontrolled growth of abnormal cells in your breast. Okay. As simple as that.
So cancer can happen in any part of the body?
Where there's abnormal growth of cells.
Okay. Okay, so I'm learning today that we have malignant breast issues. That's the deadly one, the cancer part, and we have the non-malignant, the benign. Okay. Yes, I was going to ask Dr. Akosia, what does benign mean? But since we are now going into the conversation, I know. So if I'm a lady, I have something in my breast, or I might probably not have anything in my breast. How would I know if I'm predisposed, if I might get it? What are some of the things I have to consider so that I have to be extra vigilant when I'm considering breast cancer?
Okay. So for breast cancer, there's no specific cause that do this and you would have breast cancer, or don't do this and you prevent breast cancer. But there are risk factors, like you rightly said, factors that predisposes you to the condition. And the first thing is gender. If you're a female, you are predisposed. Okay. And then
so that's why Pink October is mostly geared towards
females. Yes. Even though breast cancer can affect males, it's rare. It occurs in about 1% of cases. Yeah, so it's more likely to occur in females than in males. So gender, and then age.
How is my age a factor?
Usually, breast cancer, the age group that is predisposed to breast cancer are usually in Ghana between 40 to 49 years. That is the age group. Even though for the wide range is from 30 to about 80 years old.
Yes, so but that's a very big range. That's a very big almost range. Everybody
is predisposed.
Who is a woman?
Yes, is predisposed. But most of the cases occurs between the ages of 40 to 49 years
in
old.
Ghana.
Yes.
So I'm sure most of our mothers now are around the age. So we have to tell them to be looking out for these things.
Very much.
And what other things apart from being a woman and your age?
So apart from being a woman and your age, also family history. If you have a first degree relative.
Please.
We
don't understand the medical terms too much.
So when I say first degree relative, I mean your sister, your mother, or your daughter. Yes. So if you have a first degree relative who has been diagnosed with breast cancer, you have a double risk. Yes, your risk doubles. So family history is also a risk factor. And also the same family history, if you have any history of other cancers such as ovarian or tubal cancers in your family, then you are also at risk.
Ovarian, you mean cancer that affects the ovaries, our eggs?
Yes.
And the tubes?
Yes. The fallopian tubes, yes. So if you have...
So if I have anything that has to do with my reproductive system, where I can form a baby that somebody has had some in my family, it means I'm at risk?
Yes, you're at risk of having breast cancer. Yes. So other risk factors also include diets. A high fatty diet predisposes you to the disease.
So if I like
KFC.
Yes. I'm sure a lot of us, the food we eat now is mostly junk, and it has so much fat.
Exactly.
So we have to check that too.
Yes. And also another risk factor is obesity.
But I'm told that African men like
everything that you like that is good.
Yes. So by obesity, is it everybody that is big that is obese, or what?
No, not everyone that is big is obese. So there's actually a formula for calculating that.
There's a way you can actually know whether...
actually tell whether you are obese, you are normal weight, you are overweight. Yeah, there's actually a calculation or a formula for it.
Okay.
Yes.
So Madam Clara was saying that she had her menses at a very early age, and she's 55 currently, and she's still having her menses. That's part of the things. And how is that so?
So early menarche or menarche means early menstruation.
You have to explain.
Menstruation.
Okay.
So if you have your menstruation earlier than 12 years, and late menopause, when you have your menopause comes late after 50 years, then you are also predisposed, because the more you are exposed to estrogen, the longer you are exposed to estrogen, the higher the risk of getting breast cancer.
Okay, so it means that once a woman starts menstruating, she's exposed to high levels of the hormone estrogen.
Yes.
So if I start early and I don't end early, I'm exposed to more estrogen. So okay, so if there's anybody like that in our families, I think we have to always be on them to be checking.
Yes, encourage them to screen.
Okay.
So Clara has a multiple of risk factors.
And I also wanted to add a few risk factors. When you talked about diet, alcohol is also one big risk factor.
Wow.
Yes, I mean the research shows that when you take 1 drink a day, you're actually increasing your risk. 1 drink of alcohol a day, you're increasing your risk of breast cancer. And then smoking also.
Well, am I not glad I was brought up to know that it's not good to take alcohol.
Yeah,
I grew up an Adventist, I'm sure, and Ellen White has really helped us even before science came to explain all of these things.
That's very true. So yeah, and actually, even to add to what you're saying, smoking and alcohol is not just breast cancer, but a lot of cancers. They tend to predispose to a lot of cancers. And as she said, obesity and a sedentary lifestyle actually predisposes you. So you're always encouraged to exercise 45 minutes a day, at least 5 days a week, and then it helps you. So.
Doctor, some of us, we go to work at 5 a.m. and we come back at 8 p.m.
Yeah, so, but we have to.
You have to.
Yes, I mean, your life matters. So.
Yes, I've taken this for myself. I have to start checking it before breast cancer comes. Yes.
And the exercise, you don't have to do a vigorous exercise. You don't necessarily have to go to the gym or anything to keep fit. Just brisk walking. If you are busy at work, you can just take a 30 minutes break and do the brisk walking. It helps.
Thank you.
Oh, and also for diets, a protective factor is lots of vegetables. So as we're avoiding the fatty diets, we replace it with lots and lots of vegetables, and it also helps.
Ellen White.
Yeah.
Okay, so what are some of the things I would see in me if I might be having breast cancer?
Okay, so some of the signs and symptoms that you see, the most common thing that you see is a lump.
Okay. A
lump in your breast. That is why it is important for you to know how to do the self-breast examination, so that you can be able to determine the normal breast from an abnormal one, so that if you see any changes, you promptly talk to your healthcare provider. Yeah, so a lump in the breast, and also discharge from the nipple.
Okay.
Yes, usually a bloody discharge from the nipple. And also, apart from the lump being in the breast, you can have the lump in areas such as your armpits, where we call the axillary area. Yeah, you can have the lump there too.
Oh, so it's not just what is in front of us.
No.
It extends all the way to the armpits.
Yeah.
Hey, then the breast is really extensive.
Yeah, so you can have the lump there too. You can have the nipple discharge. You can also have some skin changes around the breast. When I say skin changes, you can have something we call skin tethering, like dimpling. You know what a dimple is?
That's it. That's okay.
Yeah, so you see them around your breast, or peau d'orange. Peau d'orange is a French word.
It's like,
And
You know, I'll ask you to explain it.
It's a French word, and it's just like the peel of an orange.
Yeah, it has some small dots.
Yes, you see those ones around your breast.
Okay.
Yes.
and to add to it, you spoke about the nipple changes. I don't know, I think Madam Clara spoke about seeing some changes in her
Yes.
breasts. So that should trigger her to actually go and follow up.
You can also have ulcerations, some ulcers, sores around your nipples or even your breast.
Or even the armpits, because you
Yeah.
said. Okay. So we've spoken about the changes of the skin,
Yes.
having some small spots, or the skin drawing in.
Dots.
Yeah.
Yes.
Yes. Then we have the skin changing color.
Yes. The skin around the breast can also become hard.
Okay.
Yes.
By
And
hard, what do you mean by hard?
Like you feel it. Like
You
when you
feel
touch
it.
your
When
breast,
you
you see
touch
that
it,
this side
yes.
doesn't feel right. Like
Okay.
it feels harder than the whole
Yes.
breast.
And also there's something called nipple inversion. You see the nipples are pointed.
They point out.
They point out. But this one, it will be pointing inwards.
So prior to the cancer being there, it would be out, but then the cancer
Yes.
can cause the nipple to
retract.
go inside.
Yes.
But
Okay.
let's not forget that there are some women who naturally have,
Have
their
inverted
nipples,
nipples.
inverted.
Okay, so
Yes.
it doesn't mean so if from birth or from the time you started noticing your body, you had the nipple inside,
Then
it doesn't mean that it's.
Exactly.
But
That's
then
why
if you
so-
didn't have it like that, and now you have it. Okay.
That's
okay.
why the self-breast examination is important.
Okay.
Yeah.
So nipple changes, skin changes, discharge. You've not mentioned pain, or breast cancer is not painful.
Usually, breast cancer is not associated with pain.
Okay.
Yes.
So if my breast is paining me,
If your breast is paining you, it could be a multiple of factors. Dr. Akosia already mentioned the benign conditions.
please can
those
you
ones are
remind us,
associated with
because
pain.
Okay,
there
so
were some big words. Maybe if you
Also,
could
I
just
spoke
give
about the position where your breast gets inflamed, where it's painful and there's an infection, the mastitis. And then I spoke about sometimes there's something called fibroadenoma, which is like it's a lump in your breast. Yeah, and it gets painful getting to, let's say, your menses. You know, women usually have pain getting to their menses. Pain in the breast, so that lump can also become painful getting to that
even
time.
pregnant women.
Yes, even pregnant women also have pain in their breasts.
So breast cancer can be very silent.
Yes.
Then it will just creep on you like a thief in the night.
Amen.
Okay. So I'm learning so much, and I hope viewers, you are also learning a lot, and you are, aside hearing it, you are keeping it so that you can share with your friends, with your wives, the men watching. This is not just for women, it's for everybody, because the breast is for everybody, or
is it?
it's for the men, because I know a lot of men go very they go very wild about breast. And for our babies too, we need it to. Breastfeeding is the cheapest and the safest way, I've been told.
And even for ourselves, we also need it.
Yeah,
women need to feel
self-esteem.
complete.
So relearning all of this is very good for us. So we are going to go on a very short break, and when we come back, there are more things we are going to talk about. So do stay tuned and stay with us.
Celebrations premiering Friday, 22nd October at 6 p.m. only on Hope Channel Ghana.
The addition stronko ebrel ewo fie. Addition boy ma ejuma enye nyinaso. Esanse so ejuma etumpo na ekonkan a. Osikasem ebe yie.
Ema ye ni emfaso bumbum achi. Na sika enyini bumbum. Nti se ejuma no edi mu saa ansa na wadwen se wodi sika komando.
Continental Free Trade Area Agreement ya be niama pabe na de bresa ejumafo yi.
Ye ekuo na nkasa ewo education unit. Ye do be content mu. 2 weeks bia.
Ye de mpanyinfo ba ha na muni abedi nkomo afa ekuo no ho na ehun faso a ewo ema wo ojumayeni.
Hope Business Forum, showing this on every Tuesday at 8 p.m. live only on Hope Channel Ghana.
Welcome back to the consulting room, and as you can see me in pink, it means we are talking about breast, boobs, nufo, fofo, bobby. There are so many names that the breast has, and we found out that it has a lot of importances. We've also found out that there are things that we have to do for ourselves, and there are things that we have to look out for as we are women and we have breasts. Dr. Akosia, let's say I'm related to Madam Clara, and maybe I'm Madam Clara's daughter. My grandma died from breast cancer. What do I have to do for myself? What can I do for myself?
Okay, so for breast cancer, especially when you have a family history of it, you have to get screened. Most of the time, if you are like Madam Clara, you have a positive family history from age 25, you can start getting screened for breast cancer.
So with screening, what do you mean by screening? By
screening, I mean the breast examinations, your yearly visit to the gynecologist to get screened, or to the general surgeon. For women younger than age 40, we do not want to use the mammogram.
Okay.
Yeah, there's something called the mammogram. It's a kind of X-ray. That is an X-ray of the breast, basically.
The breast is very important to have a whole X-ray for it. Yes. Because I thought X-ray was for bones. And there's no bone in the breast. And we have an X-ray for it.
Yes, they have an X-ray for it, where they actually take and look at the breast. That's the ideal screening method for that. And that one, we started at age 40, and it should be done yearly, along with your yearly breast exam at your doctor's office. We don't use the mammogram for younger women because it's not very sensitive, if I should say. It cannot really pick cancer when you have a lot of dense breast tissue, which we find in younger women. But as women grow, it's replaced with more fat tissue, so then you can easily pick out any abnormalities in the breast. Yes. Okay. So mainly for screening, we want you to start at 40, but then you can start earlier if you have like someone in your family who
being a younger woman, what would be my option for screening if it's not advisable that I do the yearly mammograms? What else can I?
So usually we screen with the breast examination, also with the ultrasound. Okay. Yes, but ultrasound is usually indicated if you go to the doctor's office for your yearly exam. He examines you, picks up a mass or picks up a lump, then he's like, no, we have to look at this better. Then we go for the ultrasound. If the ultrasound says there's something that looks suspicious, then we have to do something they call a biopsy, where they go and take a little of the tissue, look under the microscope to check if it's something malignant, the favorite word.
Okay, so as I've gone to the doctor's office and he screened me, how often as a young, do I also have to do it yearly as someone below 40 years? Yes, so you know we have the self-breast examinations which you do monthly on your own. Monthly? Which time of the month? Okay, so it's usually recommended that after your first day, from the first day of your cycle, 2 to 3 days into your cycle. So when I say 2 to 3 days into your cycle,
some women do not even know when the start of their cycle is. Your cycle starts when your menses starts. So when your menses starts today, it means this is day 1 of my cycle. So 3 days into your cycle, you can check for breast masses, because if you do it at a different time, there's a normal time where you can have lumpy breast tissue because of hormones. So you might think there's a mass, but there might not be. So it's always best to do it in the 3rd day of your cycle.
Okay. Dr. Ikia, for the women that are older, the mammogram, where is it available everywhere, or how do I get access to a mammogram? Where do I have to go to get access to such services?
Okay, so aside the self-breast examination, which you can do by yourself at home and then report any abnormal changes to your healthcare provider, the rest of the examination has to be done by a qualified healthcare professional.
Okay.
Yes, so all those services are available at the hospitals.
Okay.
Yes. Okay. You can't find them anywhere else.
So it's just the hospital?
Yes, please.
So I have to come to the hospital?
Yes, please.
But I'm afraid of doctors.
You
people are scary.
We are not scary.
We are very
I'm
friendly.
smiling.
Yeah.
She's smiling.
Very friendly
Okay,
people.
so I've been diagnosed of breast cancer. I've heard women say that they would rather die than have someone cut off their breast. What can I do if I'm in such a situation? What are my options for treatment? What do I do if I'm in such a situation?
So treatment depends on the stage. Breast cancer is staged, actually.
Okay.
Yes. So we have to state the disease and then actually give you treatment options. There are different treatment options. It depends on how far your disease or your condition has advanced or progressed. So we can do a lumpectomy if it's just a lump, just a surgical incision of a section of the lump. Yes, that's what a lumpectomy is. We can also do a mastectomy, depending on whether it's just one breast that has been affected or the 2 breasts have been affected. So if it's just the one breast, we can simply take the one breast out. And then if
simply.
it's not that simple. It's not that simple because, like you rightly said, it has a lot of psychological effects. Yes. So we can take one breast out or 2 breasts out. Also, there's chemotherapy where we give you some drugs to kill the abnormal cancer cells.
So there are drugs that can kill some cancer cells. Are they good?
Every drug has side effects, so it has its own side effects.
Okay.
Yes. And then there's radiation, what we call radiotherapy. Yes, so we can also do that. And then we can also do hormonal therapy. So these are the options. So when you go to your doctor would determine which options are best for you depending on how far your disease has progressed.
Okay. So I did a bit of reading before coming here, and I saw that there are some things that they can test in my blood to see if I'm also predisposed. I think it's BRCA.
BRCA1.
How does that one to work?
Okay, so the BRCA gene mutation generally is like a mutation in your genes, like an abnormality in your genes that can be passed on to your relatives. And because it's an abnormality, it makes you predisposed to certain cancers, one of which is the breast cancer. So when you have that gene mutation, especially when you have like a strong family history, your mother's sisters, your grandmothers, like so many people in your family getting breast cancer, you can report to the hospital and then they will do genetic analysis. Like they do actually gene studies to see if you have that mutation. And then they can advise the best way. Forward.
I think a few years back, there's this really popular
Angelina Jolie.
Yes, she went and
took out her ovaries.
Yes, she took out her ovaries because her breast.
Yeah.
Because she wanted that. That's very radical.
Yeah.
Is it available in Ghana?
That's hard to tell. It's hard to tell. I'm not sure if we have a lot of genetic analysis here in the country here because, you know,
our health, the limitations to our health system.
Exactly.
We pray that God will touch everybody's heart so that our health system gets better.
Amen. And I wanted to add something to the screening. Well, sometimes we are worried that, hey, what if I go and they have to cut off my breast? We've seen that most women in Ghana, they start having breast cancer symptoms 10 months before they actually present to the hospital. And that is why most of them present when it's so advanced that they have to cut off the whole breast. But once you start noticing symptoms, you go to the hospital as soon as possible. And then we can do, as she says, the lumpectomy, where, oh, it's not so big. So we just take out that part that has the cancer and preserve your breast. But if you're going to sit home and wait and do herbal medications and what's not, then you come and then they really have to take out your breast, or they tell you we can't do anything palliative. That means you're going to die.
You know, some people, I'm not downplaying herbal medication, but they'll tell you that miwedrobia ebeshe yareno ase.
Regardless of the edro, you come to the hospital. We sort out how to work with both sides here, but please come, like, seek medical advice, because truth is, breast cancer is number 2 leading in terms of cancer mortalities in Ghana.
Oh, yeah. So it's that common.
Yes, it's that common, and it's the number 1 cancer diagnosed in Ghana. It's that common, so you can't.
But even with that, a lot of women come when their breast is looking really bad.
Yes, with ulcers and it's discharging. There's an abscess and it's awful. But honestly, we can do better by presenting early. I mean.
Yeah, and I think I once saw a woman, her breast, the breast that had the cancer was so big, it had the sauce and everything around it. Some parts were black. It wasn't dark, it was actually black. And even though we've said that breast cancer might be painless, because of the infections, and she was in so much pain. The painkillers the doctors were giving her was just not working. And a lot of Ghanaian women come in that stage.
Yes.
Please, what do you have to tell us, and our men too, so that they can help us? Because it's very frustrating.
Yeah, I think we shouldn't wait to get there. That's the whole point. Once you start suspecting something, yes, there's lots of anxiety. Hey, what if they'll cut off my breast? But what if they don't? Truth is, you never know. So you have to go. And even if they have to cut off your breasts, there's always some psychological support that can be given in the process. You see a professional who can help you through it. And if you have enough money, you can actually do, how do we call it?
Breast
a boob job. Yeah, breast implants, yes. So then it's not the end of the world. It's a very difficult decision, but it's not the end of the world.
Okay. So talking about breast implants, do we have some in Ghana? Do we have people that can do it in Ghana?
Yes.
So there's hope for whoever. If I mind living without a breast, I can go and they'll put in something.
Every size, some.
Every. Okay. So that's some hope, Dr. Kia.
And also, I think that because of the psychological effects of the whole condition, the fact that you have a cancer, and then we may have to cut off your breast, the men should also be there to support and encourage the women.
Exactly.
Usually, the women refuse the mastectomy because the men don't support them. Okay, so how will I live without a breast? My husband likes breasts so much. And another point is because maybe the woman hasn't had a child yet. So the question will be, if I have a child, how will I breastfeed my child? But now, apart from breastfeeding, you can also do formula feeding.
Yes.
So that's
one condition where we might encourage you to do
formula feeding. Yes.
And actually, that reminds me, I don't know if we mentioned that breastfeeding is actually protective against breast cancer.
Yes.
So how is that so?
Well, so we've spoken about estrogen exposure, that's prolonged exposure to estrogen. Yes, can increase your risk of breast cancer. But when you're breastfeeding, it's mainly progesterone hovering around in your body. Estrogen is somewhat, let me say, layman term, suppressed. Okay. So in that way, you've actually blocked off your estrogen exposure for at least 6 months that you are doing your exclusive breastfeeding. And imagine you have 2 children, you've done about 6 months each. Most people do even a year of breastfeeding. So that's 3 years of, you've kind of cut off estrogen exposure, and then it protects you from breast cancer.
Does it mean for women that have not given birth, and more so women that are having their first children at older ages, advanced ages, they are also at a risk of breast cancer?
Sadly so, yes. It puts you at risk of breast cancer.
This breast cancer, it's like everybody has some risk, sort of.
Exactly. Yes, that is why we have to practice the protective things: healthy lifestyle, exercise, eating well. I mean, the things you can't change, you change them. Yeah. It is
of utmost importance to take care of your body, your own health. You have to take it into your own hands. Yeah, so eat healthy, exercise.
So viewers, we have some, if you have some questions to us, you can send them to the numbers that are scrolling on the screen. And our 2 beautiful doctors here who are very invested in breast would help us with the answers to help all of us understand it very well. So I'm a man. You said some men also get breast cancer. How is that so? Because I thought men don't have breasts. Theirs is just the chest.
Okay, so breast is made up of glandular and then fatty and then connective tissues. Men also have breasts, but just that's because women produce more estrogens. Our glandular tissues respond to the estrogens, and that makes our breast fuller and bigger, and theirs don't become like ours. I also mentioned that men have breast cancer too. Yes. They can also get breast cancer, but it's rare. Theirs is 1% out of all the cases. They can have 1%. So as a man, you also shouldn't ignore the symptoms that we spoke about. If you feel a lump in your breast, don't just say that, well, I'm not a woman. I can't get breast cancer, so, well, I'll just ignore it. If you feel the lump, just go to the hospital, because you are also at risk of getting breast cancer.
Okay. So, men, it's not just for the women. Pink October is for women, but men, you are also part. So as you are reminding the women, you should also be on the lookout, because if you start getting those symptoms, there's a high chance that you might have breast cancer. So as I already mentioned, if you have any questions, any contributions, kindly send them to us on WhatsApp on the numbers that are on the screen, and we'll be very glad to help you with them. So for the psychological aspect, what does the Ghana health system have to offer people that go through these things? Is there any help? Do we have psychologists who can help us with all of those things?
Okay, very good question. We have clinical psychologists, and they are available in every hospital.
Almost.
Yes, so almost every hospital. So we refer such patients to the clinical psychologist.
Okay.
Yes. So they'll talk to you, they'll counsel you about the condition, they'll make you feel better, and then it can improve your standard of living. Okay.
Dr. Hosea, any more to add on this breast? Tell us, is there any fact that you can tell us that might wow us or make us intrigued about breast?
A fact about the breast. That would be a hard one.
I think I have one.
Okay.
I read that even though boobs are twins, they are not identical. They are not. So it's normal to have one breast
slightly bigger than the
so
other.
It becomes a problem when one is obviously bigger than the other.
Exactly.
Okay.
And also, sorry.
Oh, no problem.
And also, one thing that we forgot to mention is that the breast cancer can spread.
Yes.
Okay. And that is what makes it very dangerous. It can spread to other parts of your body. It can spread to your lungs, your bones, your brain, your liver.
Your brain?
Oh, yes.
Oh, that's serious.
Yes. So in the advanced disease, apart from all the symptoms that we mentioned, if you also have other symptoms such as bone pain, seizures, jaundice. Jaundice is the yellowish discoloration of the eyes. Yes. If you have jaundice, if there's something we call ascites, that one I don't know how to explain.
Your stomach is just keep getting bigger.
And it's because there's water in there.
Yes.
Or fluid, no
water.
Okay, and I also wanted to add something, and that's why it's essential that when you are diagnosed with breast cancer, I think it's important. Most times Ghanaians don't do it often. Like, we don't want to like engage in your treatments. Like, you have to be aware of how many cycles am I going to have? What is the expectation of treatment? Sometimes we feel too timid to ask the doctor and be informed about our own health. And it's, even as health practitioners, it's very important to involve your patient in your care plan, because the truth is that that is what will influence if they will be compliant with the treatment or not. If they don't really know the essence of their third chemotherapy session, they will not come. And if they don't come, they'll relapse. Not even relapse, it will get advanced. Yes, and if it gets advanced, it will spread to other places. So it's very, very essential that even as a woman who has been diagnosed with breast cancer, you dialogue with your health practitioner, and then you try to see the expectations of treatment, what the treatment entails, what it will do to your body, what are the side effects, what to expect. All those things are essential, because far too often in the hospitals we see that women started therapy and then some way somehow they just stopped, and they come back 6 months later and the thing is in their brain. You come back 6 months later, bone pain. You get it now, it's spread all over the place. So it's very essential to have this kind of dialogue.
So I remember when I was in Tamale over the last year, in my the general surgery department, the treatment was a bit intensive, but then NHIS is there to subsidize it for a lot of the things, a lot of the drugs. They've advocated for it to be put on the National Health Insurance Scheme, so it's available. And when I found that fact out, and I found out that women are still hesitant to come for treatment, it really broke my heart. I had one lady that I had the interaction with. Her husband would not even come to the hospital to see her after they had removed her breast. And she before the surgery, she didn't want to have it. We convinced her, she had it, and afterwards, it was her last born. Her elder sons did not want to come and see her. So she was always sad. She wasn't getting better.
Obviously.
She took longer to get better. She eventually got better, but it was just a very sad situation for me. So it was there that I saw that actually breast cancer and its effects on the whole family is very dire. It's really depressing, but I hope with the education that these beautiful doctors are giving us, well, dear men, please, you love breast, help us help you so that we can all have what we want. Isn't that so?
Yeah.
Okay, so please, is there anything you'd want to add? I think our viewers have understood everything that you said, because the questions are not coming, or maybe they've not understood anything
we said
at all. Remember that joke that they said, do you understand? Yes, sir. So please, is there something you want to add to the conversation as we start rounding up the show?
Well, I think we said it's all, if not, yeah, we said most of the things. So I'll just encourage the women to get screened every year. It's very important. And also the self breast examination. There are resources available. You can go on YouTube, you can check on Google to see how it's done.
I'm hoping that the next time we have a conversation on breast, we can actually show how to examine
with
it.
The mannequin.
With the mannequin.
You know what to use it?
No, we have to.
Or a volunteer.
Okay, Dr. Akosia.
I want to say that for the young women, we've said that the peak age is 40 to 49, But the young women shouldn't get too comfortable, because we have seen women in their 20s with breast cancer.
Yeah.
So don't get too comfortable and think that, oh yeah, your heyday, so it won't happen. It can happen to you. That is why Pink October is not just for the elderly, it's for everybody. So please, let's continue to do the self-breast examinations, and then when we hit
and
40,
the young men that are saying you want to examine young women's
she
breast,
says nothing like that. She says that
she's not your wife.
Okay.
She's not your wife. Don't go and examine anyone's breast. The men I'm addressing are the men that are legally married. Okay.
And I would also like to say that most of the young women, or every young woman in Ghana and across the world, should also take this opportunity this October to get screened. In October, usually the breast screening is free in most hospitals.
Yes.
So just take the opportunity, walk into a facility and then get screened. Yes.
At the church that I currently fellowship with, that's the Prince Emmanuel SDA Church at Osu. Forgive me. Every Saturday from 12 p.m. to 2 p.m. They have breast screening there. I think yes, our church really tries to do those things. So I'm glad I'm part of such a fellowship. And
that's a good point. Actually, research shows that the factors that influence screening is actually being part of a group, especially in our society, Women's Fellowship, PESDAC, you know, all those things there, because then you have some free screening coming somewhere, and then you'll be screened. So you just join a group. Join your ladies. Yes. Or Amo will not do it. I will not do breast screening, but we join a group.
They can organize it for the women.
Yeah.
I'm waiting for a church where the group would organize breast screening for the women. They will go and bring the specialists and sort them out so that they can sort their ladies out. I believe we've had a very interesting conversation today,
and a lovely time.
Yes, so we should get screened regularly. We should check our lifestyle. We should not be afraid to come forward, and we should be willing to talk about it so that it doesn't seem like it's a curse on anybody. So that this whole thing about breast cancer would actually go away, because as I have been saying, we all love breast. Men love breast.
Babies love breast.
Babies love breast, and women too, we love our breast. It's been a very wonderful time with you here, ladies, and I hope you join us when we have more interesting stuff to talk about too. So thank you very much, Dr. Ikia. Thank you very much, Akusia. And all our viewers say thank you too.
You're welcome.
Thank you to our viewers as well.
So thank you very much for joining us today. We know you've heard a lot, you've learned a lot, and all of these things that you've learned would help you make better health choices. We do hope that you join us next week, Monday as well, and we'll bring you another interesting topic. So do make sure that you tune in at 8 p.m. and we'll be here waiting in the consulting room for you. Thank you very much. Enjoy the rest of the evening.